have my PPE. The scene looks safe. Is the scene safe?
Yes.
I see one patient. Are there others?
No.
Okay, and are there any bystanders?
No.
Okay, my patient is 60 years old. She is a white female and is seated in moderate distress with a nature of illness of shortness of breath. So I'm going to go ahead and call for ALS backup, and I'm going to start by asking my patient her name. So, hi, I'm Abby. What's your name?
Julia.
Okay, and do you know where you are?
I'm in the living room.
Okay. Do you know what day it is?
Thursday.
Great. And what happened to you today?
I just can't catch my breath.
Okay, so my patient is talking, her airway is patent, and I'm going to go ahead and start with breathing. Okay, so my patient is breathing, but it is inadequate because the breaths are shallow and very rapid, so I'm going to administer 15 liters a minute of oxygen via a non-rebreather mask. Okay, so I have strong pulse. Now I'm going to assess for any major bleeding or injuries that may compromise breathing or circulation. Okay, my patient is pale, cool, and clammy. So I'm going to say that this patient is a priority and request immediate transport. Okay, so I have a couple questions for you. Did the pain start gradually or all of a sudden?
All of a sudden.
Okay. Does anything make the pain feel better or worse?
No.
Can you describe the pain?
It feels like my lungs are being pressed together.
Okay, and where is your pain? Does it go anywhere else in your body?
No, it's just in my chest.
Okay. How would you rate it on a scale of 1 to 10?
8.
Okay, thank you. And how long ago did you start feeling the pain?
2 hours ago.
All right, now I just have a few more questions for you, Julia. Do you have any other symptoms?
No.
Okay, so just shortness of breath. Do you have any allergies?
No.
Okay, do you take any medications?
Yes, I take this inhaler.
Okay, so can I just look at it?
Sure.
Okay, so my patient has Proventil. It is an asthma inhaler. Has this ever happened to you before?
Yeah, I had an asthma attack like this 5 years ago.
Okay, and when was the last time you ate?
Just ate lunch.
All right, and what were you doing when you first noticed you were having difficulty breathing?
I was out walking.
Okay, thank you. Okay, so did you fall over any time in the last week?
No.
Okay, so I'm just going to eliminate trauma. Right, I'm just going to take a quick listen at your breath sounds. Okay, so my patient is wheezing and breathing rapidly. Now I'm going to check the neck and C-spine. Okay, my patient is negative for JVD and tracheal deviation. So I don't need to pursue C-spine immobilization at this point. Okay, and abdomen is soft and non-tender. Okay, so I'm just gonna take your blood pressure. blood pressure is 170 over 88. Okay, and now I'm just going to take your pulse. Okay, her pulse is 90 beats per minute. Okay, now I'm just going to listen to your breathing. Okay, and my patient's respiratory rate is 22 breaths per minute. So the patient is suspected of an asthma attack and will be reassessed every 5 minutes. ALS is here, so I'm going to give a report. So my patient is 60 years old. She is having difficulty breathing. It started 2 hours ago when she was walking, and she doesn't know what caused it and has no radiating pain. She has no allergies and takes Proventil for her asthma and has had an asthma attack in the past. She says nothing is making her pain better or worse right now and rates it an 8 out of 10 on the severity scale. Her blood pressure is 170 over 88. Her pulse is 90 and her respiratory rate is 22 breaths per minute.